My name is Dr. Adam Farber, and I would like to talk today about rotator cuff tears. In order to understand rotator cuff tears, let us first talk about normal shoulder anatomy. The shoulder is a ball and socket joint where the socket, also known as the glenoid, is part of the shoulder blade, and the ball, also known as the humeral head, is part of an upper arm bone called the humerus. If you view the shoulder blade from behind, you can see a ridge of bone coming off of the shoulder blade that passes over the top of the ball and meets up with the collarbone in front. The rotator cuff is a series of 4 muscles that surround the shoulder blade and attach to the ball of the ball and socket joint. There is one muscle in front called the subscapularis, one on top called the supraspinatus, and 2 in the back named the infraspinatus and teres minor. These muscles pass over the ball much like the cuff of a shirt sleeve would pass over your wrist, and this is where the name rotator cuff comes from. If you remove the ball and look at the rotator cuff and shoulder blade from the side view, you can see how these muscles and tendons form a cuff like the cuff of a shirt sleeve. When rotator cuff tears occur, they typically occur where the tendon of the rotator cuff attaches directly onto the bone. After the tear occurs, there is a hole present. This is a view of the front of the shoulder where you can see a small hole where the rotator cuff tear is present. This is a view from the side of the shoulder where you can again see a hole in the rotator cuff due to a tear. This is a photograph taken at the time of surgery where you can see the hole from the torn rotator cuff. This is the edge of the rotator cuff, and here is the bone where the rotator cuff should be attached. Rotator cuff tears typically cause pain on the upper outer aspect of the shoulder and arm, in the area depicted in red in this diagram. This pain is typically aggravated by reaching, lifting, and performing overhead arm activities. This pain is often worse at night, and patients frequently report difficulty sleeping. Some patients may also notice weakness if the rotator cuff tear is large. The recommended treatment for most rotator cuff tears is surgery. Although this should be performed either in an open fashion with large incisions or arthroscopically with minimally invasive incisions, I prefer the arthroscopic approach in the vast majority of cases. Arthroscopic surgery involves numerous small incisions around the shoulder. This is performed on an outpatient basis, meaning that patients do not have to spend an overnight stay in the hospital. The surgery typically takes 60 to 90 minutes to perform. This is a photograph displaying the setup for arthroscopic shoulder surgery. A small camera is placed inside the shoulder through a small incision on the side, and a shaving device is placed in the back of the shoulder through a similar small incision. The rotator cuff tear is fixed by placing small plastic screws with sutures attached into the bone where the tendon should be attached. The screws, called suture anchors, are seen in this slide before and after they are placed into the bone. Once these screws are placed into the bone, the stitches are then passed around the tendon, and when the stitches are tied together, the tendon is pulled back down to the bone. This is a series of photographs taken during surgery showing the suture anchors in place in bone before and after the sutures are tied together. In the figure on the left, the tear is still visible because the sutures are not yet tied down. In the figure on the right, the sutures have been tied down, and you can see the tendon now firmly reattached down to the bone. For further information about rotator cuff tears or rotator cuff repair surgery, please feel free to contact my office at 480-219-3342 or visit my website at phoenixshoulderandknee.com.